So the Health Department has extended the submission deadline for public comments on the amended COVID-19 health regulations. Now, this follows requests and concerns from South Africans that a 30-day period was not sufficient to scrutinize these proposed regulations. The Health Department has disputed reports that these new rules or proposed rules are an attempt to control people's lives. And that was at a briefing before Parliament's Portfolio Committee on Health yesterday. Newzroom Afrika's Athi Mtongana takes a look.
Minister Dr. Joe Phaahla says the 24th of April, which is the new deadline, will allow South Africans to develop substantial representations and enough time to scrutinize and interact with all the sets of proposed regulations.
We are extending to the 24th of April to allow also on WhatsApp further comments. We are also considering, as advice keeps coming, that we may need to separate the broader public health measures of surveillance of notifiable medical conditions from the specific measures which are now, for instance, implemented under the post-disaster recovery.
The Minister and his team were briefing Parliament's Portfolio Committee on Health on the progress of amending the regulations. The Department of Health says it has received over 150,000 public comment submissions so far. It will only be able to come to a final figure once the deadline has been reached on the 24th of April.
Termination of national state of disaster has created a gap that is as a result of the absence of regulations to manage future pandemics and other communicable diseases, which these amendments that we are working on are closing that gap perfectly well.
The department has been heavily criticized by various stakeholders, including members of the Portfolio Committee, on the draft regulations regarding the permanent status of the regulations under the National Health Act.
There is a misconception that these are new, completely new regulations. As you will see from the presentation, there has been some major amendments in some cases, but in many cases it's basically an amendment on regulations which actually have been in existence for the last 5 years, from 2017. So that's what we will be presenting, and we just want to assure the honorable members and the public that there is no desire from myself as a minister and the team from health to want to continue to control people's lives unnecessarily.
The minister says South Africa cannot simply do without the regulations, given the fact that COVID-19 is still around. Public comments can also be submitted through WhatsApp on 0600 123 456 and on email at legalreviews@health.gov.za. For Newzroom Afrika on Channel 405, I'm Athi Mtongana in Parliament.